Thank you, Dr. Sinha. So we are very honored to have Dr. Brook with us today as our keynote speaker. Dr. Brook is a distinguished physician who specializes in pediatrics and infectious diseases. As a professor at Georgetown University, a cancer survivor and author, he brings a unique perspective to patient care and medical ethics. His resilience and dedication in improving health care is truly inspiring. So please join me in welcoming Dr. Brook.
It's a pleasure and an honor to be invited to speak in the USC Cancer Center. I was fortunate to spend time myself in USC when I did my fellowship 50 years ago. And I also worked in the pediatric department afterwards, mostly in the emergency room for 2 years. So it's always great to come here. The knowledge that I gained served me a lot in my career. Being a laryngectomy is challenging. And it's very difficult to go back to life. It's difficult because laryngectomy, like head and neck cancer patient, are dealing with the most difficult issues people can have. Functions such as communication, eating, and social interactions are very difficult. What I plan to do today is give you an overview of what a patient encounter when they face cancer and its treatment, how to make life better as an advocate and speaking again, and also some of the issues they deal with, such as psychological one. Once a patient learns they have cancer, they face a major crisis. I know that in my case, I felt my shattered invincibility. I never faced something like that before, such as mortality, anxiety about the uncertain future, becoming dependent on other people for everything, and everything is affected. Your relationships with people, your employment, which has significant ramifications on their livelihood. And then you have to make decisions, sometimes very difficult to do, such as, should I keep it secret? What kind of therapy should I get? And then you go through radiation, sometimes chemotherapy, and many do have to undergo major surgery. All of those have significant lifelong side effects. What can help the patient is to learn to be your own advocate. described it in my book, My Voice, I had to be on the watch to make sure no medical errors are performed. But by being an expert, by reading, by talking to others, you can recognize when something is wrong, hopefully, and educate your medical providers about your condition and the need. Physicians, although many of them feel very knowledgeable and experienced, we don't know everything. We and the medical staff is always learning how to improve. And with our help, by communicating with them, we make things better. And when we recognize that something is not right, tell them, share it, so that they will recognize what they can do for you better. And don't hesitate to get a second opinion, because it is something that can help you get another view of what's going on. Following surgery, there is a very difficult period. Am I cured? Is everything gone? We actually never know. And we'll need to learn to live with uncertainty. And that's why follow-up is very crucial. Follow-up doesn't only include medical, otolaryngological one, but other issues. We need to learn that it's not enough to rely on scans. Scans have limitations. And unfortunately, and that was in my case, I had a recurrence, but the CT or MRI didn't see it because it was small and wasn't detectable. But good otolaryngological examination revealed it in time. So, as physicians, we need to go back to the basics of listening to the patient and examining them thoroughly all the time. When laryngectomy, you get over the surgery, they face the challenges of speaking again. They have to choose between 3 and even more now method of speaking. They have to become able to be understood, and that's very difficult amount of times. The quality of voice interferes with a lot of life issues and contribute to many problems: unemployment, depression, loneliness. And that's where the help of our medical team, speech pathologists, psychologists, and otolaryngological is crucial in the treatment. Also, discrimination is happening society has to learn to be more acceptable and amenable. The principle of having a good life is to get good nutrition, be hydrated, deal with the swallowing problems, pain, reflux, maintain good tracheal health and sputum quality. A lot of those principles have to be learned, and in my own contribution, I try to teach laryngectomies how to do it in the guide that I wrote, and happily now is available free in 27 languages, and the list of languages is growing. Preventive care is crucial. Dental one is important because of the xerostomia. We tend to have dental caries, losing teeth, and that is why every 3 to 6 months all head and neck cancer should be examined by a dentist or at least a dental hygienist. Prevention of infection is crucial. Vaccination against respiratory pathogen can prevent many issues in patients. Psychological issues are very crucial to recognize and deal with. The second highest rate of suicide in cancer patients is with those with head and neck cancer. Depression, anxiety, isolation is very common. Many people resort to substance abuse. It can interfere with intimacy, sexuality, and interactions with family, friends, and spouses, and also interfere with livelihood. Dealing with depression can be very important, and it should become with motivation and wish to get better. Active role of the person is very important. Of course, one needs to exclude medical issues such as hypothyroidism, anemia, and other issues. And what the person can do is minimize stress, return to previous activity, and resort to antidepressants or other medication, and professional help or friends or family help. The role of support group is very important. Local and national laryngectomy on head and neck cancer groups are very helpful to patients in maintaining their life and support. return to life also includes doing things for fun, keeping physically active, and that can be done by volunteering, by helping others, especially new people, and by finding meaningful and purposeful targets, thing that you like. Turn the drama and cancer tragedy into purposefully helpful thing for yourself and others, such as volunteering in schools to teach children about the cancer risk of smoking and alcohol. There are also some benefit for laryngectomy. We don't snore. We have great excuse, men, not to wear a tie. We don't smell bad things. What I do is when I pass somebody smoking, I do this. When I can still breathe. We have low risk of aspiration, and we are easy to resuscitate by people who know how to resuscitate us, not intubate us through the throat, but through the stomach. So, I'm stopping because I need to catch my breath, so I apologize. Well, life as a laryngectomy can be also a positive way. We appreciate, like every head and neck cancer, that we are still alive, and we can use this setup as a positive thing to help others. And I have dedicated my life after becoming a laryngectomy to do exactly that. And like many, most cancer patients don't wear the diagnosis on their neck or face. We do. And we set, in a way, an example to everybody else that we continue with life despite the fact that we got sick. Finally, I'd like to show you that book that I wrote, and I invite you to read them. They are all available free. Yes, ebook, some from the American Academy of Otolaryngology website, and through my website. I want to thank you for your attention. issues. But infections, I studied tonsillitis, otitis, sinusitis, head and neck infections, and intracranial infections, among others. But I had to learn, and I learned from my experience, and I read, and I had very good speech pathologists and physicians who helped me. And I decided first to have a website that I write answers to things that I know laryngectomy struggle with. And the blog grew and grew and grew, and after 4 or 5 years, I said, what if I make a guide out of it? And that's what I did. And then things always change. So as I learned more, and a lot of it I learned from the Facebook sites, that people tell them what bothered them and what bothered. I also learned from my own issues, and I added more and more. So every 2 years, I have a new addition to the guide. It's now the 5th edition. And when the COVID pandemic happened, I wrote a guide for the laryngectomy for the COVID Foundation. Great time. We are all fortunate that there hopefully won't be new editions for the COVID one. I can't hear you. Maybe you can have a microphone.
As a medical professional, what was one of your biggest challenges?
One of my biggest challenges as a patient was to start to be critical of my colleagues who did not measure to the standard that I expected. And it was difficult when I was in the hospital to tell them what they did wrong. But I'm very, very happy that they accepted it and changed. And that was one of the biggest among other challenges. I also, I am fortunate as a physician that I recognize many things in me early. And that's my luck, because I was able to overcome many stumbling blocks and medical issues. I hope that other patients can learn to recognize it too and communicate with their physicians about it. So I think one of my challenges or issues is that because of the way medicine is practiced today, patients don't have enough time with their doctors, and because of the rush to see the next patient, they may not recognize some important issues that need immediate addressing.
What advice would you give to someone newly diagnosed with head and neck cancer, and specifically a laryngectomy?
Yeah, as happened to me, I learned go to center medical center in Washington. And they were wonderful people and cared a lot about me, but they didn't have enough experience in laryngectomy. They did 2 to 4 to 5 a year, but they didn't do as good a job in the early stages of my care. And after trial and errors, I recognized I had to go to a place where they do laryngectomy 2 to 4 times a month. And that's where I got good care. That's my advice. The other advice is get a second opinion if you are not sure. And medicine is not etched in stone. People have opinions, experiences, and it's an ever-evolving field. And that's my advice.
This way you can hear me a little better. Yeah. As they say in the old country, kol hakavod for you for this presentation. Thank you. What do you see going forward for those of us who have had head and neck cancer as the biggest challenges in the years ahead that we might be facing and that we really need to be aware of? Thank you.
The challenges is first, don't focus only on the head and neck cancer. As we age, we have other issues. Heart, lungs, kidney, other cancers, prostate in men, ovarian or OBGYN in women. So don't neglect those, and don't neglect dental care. Take care of your psychological situation of whatever it is, and many patients do have it. Get help, get support, and finally, make sure you deal with the side effect of treatment. Many people deal with the side effect of radiation through life, and unfortunately, it gets worse, not better. Some complication like carotid artery stenosis or paroxysmal hypertension happen 10, 15 years later. Don't neglect them.
Dr. Brook, you're very inspiring to all those that have had laryngectomies. I have kind of 2 questions. You mentioned side effects, and I know in seeing the presentation that you were going to be here, that you have mentioned a problem that I have, which has to do with swallowing, and wondered if that is getting better for you or if it always continues to be an issue. And then my other question has to do more with the importance of exercise. And also in looking or seeing about your presentation, I seen after you had a laryngectomy and got back into trying to get back to normal life, that you were active in riding a bicycle. And I also saw that you were even kayaking, and I wondered how you were able to do that. But again, thank you very much for your presentation.
My lecture was supposed to be 20 minutes. I could not deal with everything. You can have detailed answer to swallowing in my guide. I struggle with swallowing too. And there are ways of coping with it. By chewing better, by mixing it with water, by choosing food that you can swallow, and if necessary, get surgical or gastrointestinal interventions such as dilation, or even putting a stent. So there are answers to that. Yes, I biked, I kayaked. I don't recommend kayaking to anyone. I tried it just to prove it to myself. But getting into water is risky and dangerous. Above the stomach. Biking, if you can, is a wonderful way of keeping in shape. Being in good physical shape make your heart and lung function better, which is good as a laryngectomy, because laryngectomy do not use the whole capacity of their lungs, because we don't need to inhale very deeply, and they may develop some atelectasis of the base of the lungs. And that's why doing physical activity a few times a week is good and important.
Thank you, Dr. Brook. Continue with the rest of our presentations. Thank you.